Once a tooth is extracted, there are two ways to approach an implant. One is to graft the bone so that the bone doesn't collapse, let that heal for a period of about 3 to 4 months, and then place the implant, which requires another several months of healing. So it's a two-step procedure. Oftentimes, if the socket is intact, if there's no frank infection, we can place the implant directly into the extraction site. The hole is already there. So we can shape the space, place the implant, provided it's stable, we can graft the bone around it, and you can do that procedure in one setting, and then 4 months later, you're ready for the restoration rather than just putting the implant in. It's an advantage, cuts the healing time in half, and allows you to get to the final restoration in a quicker way. So the idea being, when you do the extraction, you do it as a flapless procedure. You don't raise a flap, you don't make an incision, and you can place the implant directly into the socket, and that preserves the soft tissue and bone architecture to improve aesthetics, especially in the aesthetic zone. And that's a critical piece. I mean, taking the tooth out gently, it almost looks like you photoshopped it out. So you're going around underneath the sulcus, you take that tooth out gently. The soft tissue architecture is exactly the same. You're not making an incision that can shrink a little bit. So what you're doing is you're taking it out without any disruption in the soft tissue, place the implant. The dentist can then place either a restoration or a restoration that sits like a little egg in a bird's nest, if you will. And then what will happen, that'll preserve the soft tissue architecture and allow them to maintain their aesthetic profile of the soft tissue while they're healing the implant.